My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. I want to thank you so much for joining our presentation today. For those of you who are not familiar with the Women's Fund, we are a nonprofit in Houston dedicated to providing women and girls with the tools that they need to be advocates for their health. And we do this through focused seminars like today's presentation. We also offer curriculum-based classes and publications. All of our services are free, including our publications, and you can download free PDF versions from our website, or you can also visit our website to request a publication request form for physical copies. So today's presentation is the final presentation of our diabetes awareness series, and I am honored to introduce Dr. Pooja Sehgal. After graduating from medical school at Government Medical College in India in 1997, Dr. Sehgal went to the Wichita Falls Family Medicine Program for her internship in family medicine, which she completed in 2005. She completed her family medicine residency at Baylor College of Medicine in 2007. Dr. Sehgal is a member of the American Academy of Family Physicians, the Texas Academy of Family Physicians, and the Harris County Medical Society. She is currently serving as president of Harris County Academy of Family Physicians for 2017. When she's not caring for patients, Dr. Sehgal enjoys spending time with her children and traveling. So we are so very excited to have you here today, Dr. Sehgal, to give this presentation over diabetes. And I will ask that if you have presentation or questions throughout the presentation, please add those into the chat, as we have allowed time for a Q&A at the end of the presentation. So without further ado, I will turn the presentation over to you.
Thank you so much. Can you guys hear me okay?
Yes.
Okay, awesome. So this is very important that we are talking about diabetes. As you all know, that November is the Diabetes Awareness Month. And you know, it's important to talk about diabetes because I'm going to show you some stats that are really alarming. Diabetes is the silent killer, meaning, you know, a lot of people who have diabetes don't even know that they have diabetes unless, you know, they go to see their doctors and get tested. So early in the course of the disease, patients do not have any symptoms, but because they have this condition that can really cause some complications, and you know, their other organs can get affected. So that's why we call it the silent killer. Next slide, please. So I'm starting off with just a question, and I think most of you should know the answer to this. Diabetes increases your risk of having a chance of having stroke or heart attack. Answer is yes. And I'm going to show you later in the presentation that it does increase the risk of both stroke and heart attack. Next slide, please. So now talking about diabetes. What is diabetes? Diabetes is basically an inability to control and utilize the sugars. As we all know, we need sugar because it is the instant source of energy. So we need sugars to be able to function. Problem is when we have too much sugar, because all this extra sugar starts pretty much acting like a poison to our organs. So when we eat food, our food is converted to sugar by digestive processes. Then in response to this sugar in the body, pancreatic gland, which is like a leaf-shaped gland in the middle part of the body behind your breastbone, it secretes a hormone called insulin. Insulin is required to make the sugar to enter the cells, or the sugar to be utilized as a source of energy by our body. So insulin is the hormone that we all need to process this sugar. If this sugar cannot enter the cells, it is going to remain in your bloodstream, and that's when the sugar levels in the blood will go up high, and this is diabetes. So diabetes in the body can be due to two underlying defects. It's either somebody is not able to produce insulin, that means insulin deficiency, or in some cases, you produce insulin, but you are unable to utilize this insulin, meaning you are resistant, or your cells in the body are resistant to this insulin. So based on these two underlying mechanisms, we have two different types of diabetes, type 1 and type 2. Next slide, please. So we are going to talk a little bit about type 1, but most of this presentation is focused on type 2, which is the most common type. So type 1 diabetes is really 5.4 to 5.5% of all the diabetes that we diagnose in our country. This is also called juvenile onset, meaning this is diagnosed early on in life, in younger age. Why? Because this is the insulin deficiency diabetes, or this is due to the deficiency of insulin. And, you know, if you don't have any insulin, the sugar level stays high, and then you are more, you know, you're going to more likely to have complications because, you know, you were born with a defect, or really not at birth. After a certain age, when you're very young, there is some kind of process in the body where certain cells of the body start destroying the cells of the pancreas. These are the beta cells that produce insulin. So something goes wrong in the body, and it is an autoimmune disease where your beta cells of pancreas are specifically targeted by body's own cells. So these cells die soon and they cannot produce any insulin. So this is really diagnosed early on in life. I have heard as young as 3 years of age. I think that's very, very sad. Most of times people are diagnosed in, you know, their early teens, but, you know, the 3-year-old kids have been diagnosed with this. And that's a sad situation. So these people, their treatment is going to be either insulin shots or pumps. These people require insulin to stay alive. And these people cannot, you know, go very far without insulin. So this is a very different kind of diabetes. There's not much you can do other than give them insulin to make them, you know, stay alive and stay healthy. But, you know, most of these people, if they are diagnosed at the right time, they do very well. So, you know, that's the, I think, saving grace when it comes to type 1 diabetes. However, we are going to talk a lot about type 2 diabetes today, because that is probably 95% of all diabetes in this country. Next slide, please. So this is what we are going to focus our attention on, because a lot of this can be prevented. And that is what the focus of today's discussion is going to be: prevention of diabetes, or if somebody has it, treatment. So I'm not going to talk a lot about the treatment with medications, but feel free to ask me any questions at the end of the presentation. I'm going to focus more on prevention and what basically is type 2 diabetes. So as you can see, 95% or more diabetics have this kind of diabetes. This is usually called adult onset because it is seen a little bit later in life. However, the sad news is I have seen people as young as 14 years of age with type 2 diabetes. It is a sad situation, and it is closely linked to obesity or your weight gain, because our kids are now brought up on all the junk foods and they eat processed foods and high sugary foods. This is really a problem in pediatric population also. This kind of diabetes is due to insulin resistance. And as I said, related to obesity and very strong genetic component. Also seen in certain races more than the others. African Americans, Hispanics, and Native Americans are more at risk. However, anybody who's not taking care of their health, regardless of whether they have family history or not, just because of your weight, you can become diabetic. So all of us have to be very, very careful. Just because you don't fall in those high-risk groups and you don't have any family history does not mean that you can go on a eating frenzy and eat anything over a period of time. We all can develop diabetes. Remember, this is closely related to obesity. Next slide, please. So these are some of the alarming stats. As of 2014, more than 34 million people of all ages in this country have diabetes. And this is equal to about more than 10% of US population. But I can also tell you that this is the tip of the iceberg. These are the people who have been diagnosed. This doesn't take into account the people who have not been diagnosed. And we in our physician community truly believe that the number is way higher than this, because a lot of people do not seek medical care unless they are very, very sick. So we are not, taking into account the people who have not been diagnosed. Excess weight promotes insulin resistance, and this is the chief risk factor for diabetes. You're going to hear me talk about weight and diabetes over and over again, because really, if you can take one thing out of this seminar today, please try to understand what we can do to prevent diabetes, and if we have diabetes, what can we do ourselves to make sure that our diabetes remains controlled. More than 70% adults in our country today are overweight or obese. And because obesity is increasing, the number of diabetics is also increasing. According to CDC, the incidence of type 2 diabetes has more than tripled in past 30 years. And if this current trend continues, 1/5 to 1/3 of all Americans will have diabetes by year 2050. And this is a huge, healthcare risk. Next slide, please. Okay. Diabetes is a rapidly growing heart health and threat to the health. It is a serious disease. Both kinds of diabetes accelerate the aging of our bodies. Remember this. Anytime you have diabetes, it does something to our organs that they start aging so fast. Any kind, you have type 1 or type 2. So most of the patients who have diabetes end up getting either a kidney disease or heart disease or some other problems like the blindness or nerve disease. So development of cardiovascular disease is accelerated because of diabetes. In the past, we have almost thought that having diabetes pretty much means that you have heart disease, because it doubles the risk of heart attack and stroke. And this is answer to the question that I asked in the beginning. Just having diabetes, now you have doubled your risk of ending up with either a heart attack and stroke. Next slide, please. So this is just a small list of complications. Look at everything that people in this country die of is due to diabetes or in somewhere linked to diabetes. Heart disease, stroke, high blood pressure, blindness, kidney disease, various infections, including your female vaginal infections and yeast infections, nervous system diseases, meaning your nerves are now involved, and blockage of your peripheral arteries leading up to amputations, then your pregnancy complications. And these are just some of the bigger complications. I mean, you can have any issue with diabetes. You can have a small cut if you're a diabetic, and that cut may not heal for a long period of time because your healing is reduced when you have sugary blood. So we are going to talk more about these things in the lecture. Next slide, please. Life expectancy is shortened, as we can all imagine. Adults with diabetes are 2 to 4 times more likely to die from heart disease, heart attack, than adults who are not diabetic. This goes without saying that you have to make sure that if you have diabetes, you take very good care of your diabetes so that you don't end up with a heart attack. Diabetes is one of the leading causes of kidney disease and blindness in older adults. In fact, if any of you has ever visited a dialysis unit or know somebody who has kidney failure, there are 2 major causes. It's either your blood pressure or your diabetes. Most people with on dialysis or kidney failure have either of those conditions, and those 2 conditions, diabetes and hypertension, are also very closely linked to each other. Approximately every 30 seconds around the world, a leg is amputated. 85% of these are due to complications from diabetes. Diabetes also increases the risk of certain types of cancer: liver cancer, pancreatic cancer, colon cancer, breast cancer, bladder cancer, and uterine cancer. I mean, think about all these things that you can get just because you have diabetes. The other thing that I wanted to tell my audience today is metformin, which is considered the gold standard for diabetes, the medicine that is given to all diabetics, has been known to decrease the risk of colon cancer in some studies. So I think that is really a good thing for us, because as we are giving this to our patients, we truly believe that somewhere we are decreasing the risk of colon cancer in future. Next slide, please. So how do you diagnose diabetes, and how does a person know that he or she has diabetes? As I told you, Earlier in the course, you have no symptoms. That's why it's called a silent killer. I mean, it doesn't make you feel bad. You feel like normal. But it's important that you are diagnosed, or at least you should be screened for it annually. It is very simple to diagnose diabetes. It's done with a simple blood test. If you go see your doctors for your annual visits or annual, wellness checks, they will usually do your fasting blood sugar check. And if your sugar stays less than 99, this is considered normal. This is where our sugar should be. However, on 2 different occasions, if your fasting sugar is elevated, meaning it is over 100, but still remains less than 125, you are considered pre-diabetic. That means in the next 10 years, you have 25% more risk of developing diabetes compared to somebody who doesn't have your numbers today. And if your fasting blood sugar remains more than 126 on 2 different occasions, now you are considered diabetic. No other testing is usually needed. Now, if you show up in a doctor's office and your blood sugar is 300, well, we don't need any other test. You are a diabetic. Other test that we do, it's called hemoglobin A1C. This test measures your blood sugar or average blood sugar for the past 12 weeks or 3 months. If this is reported as a percentage number, if this number is less than 5.7%, you are considered to have normal blood sugar. If this is between 5.7 to 6.4%, this is considered pre-diabetes. And if your number is more than 6.5%, now you are considered a diabetic. And this test is done in all diabetics every 3 months, because doctors see these patients with diabetes every 3 months, because we usually adjust your medications based on this number. And this is how doctors know whether you are well controlled on your medications or current medications or not. Next slide, please. So what are some of the symptoms of diabetes? The symptoms are increased urination, increased thirst, increased appetite, weight loss, usually seen more in people who have insulin deficiency kind of diabetes, tiredness, blurry vision. This is important to understand these symptoms. Not everybody is a classic book picture. However, if you think that you are having a lot of urination, like I wake up multiple times at night because I can't, rest. I have to use the restroom a lot. You may truly have diabetes. Do not ignore it. I have actually seen a lot of women who come to me and they talk about, maybe I have a UTI because I'm peeing a lot, and they actually may have diabetes. If you feel thirsty all the time, regardless of how much water you drink, you may have diabetes. Increased appetite. These people, it's very distinct in these people are diabetics. These are usually seen more in type 1 diabetics. These people will eat a lot. They'll feel hungry all the time, but they never can gain weight. They feel sick. It's not that they feel healthy, that they are not gaining weight. They feel sick. So this is another, thing that we can kind of say that may have diabetes. So of course, testing is required. And then like a tiredness, like a weird tiredness. No matter what I do, I always stay tired. That could be diabetes. And then blurry vision. This is another one that I have seen a lot in my practice. These people will come to us and they will usually tell us, I can't see, I see blurry. And then when you really, do their blood sugar test, they may have diabetes. But remember, these symptoms are not only due to diabetes. If you have these symptoms, you must talk to your doctors and get tested for diabetes. But these symptoms could be due to any other disease. Thyroid disease sometimes can have some of these symptoms. Blurry vision could be due to a lot of things, but it's good to get tested. Next slide, please. So this is one thing that you have to take away from this lecture, that type 2 diabetes is preventable and it is reversible. Just because we have told you that you have diabetes, do not think that this is a death sentence. This is something that can be very well controlled. We have a lot of tools nowadays. We can control your sugars very well. We can control your diabetes, and people with well-controlled diabetes lead a normal, healthy life. So remember, the heavier you are, the greater the risk that you will develop to type 2 diabetes. Whereas type 1 diabetes is a disease of insulin deficiency. As I told you earlier, type 2 diabetes typically develops because your body is insulin resistant. So meaning you have insulin, you're producing insulin, and sometimes you're producing more than required amounts of insulin, but you are not able to utilize this insulin. All the fat cells in the body, fat in the body is resistant to insulin. So these people actually end up wasting a lot of their insulin because they can't utilize this, and then pancreas keeps on producing more and more, and eventually your beta cells get tired, and then they start dying off because they have pretty much secreted a lot of insulin. So that's why these people who have type 2 diabetes usually start off with medications, but may end up on insulin shots only because they have utilized all of their body's insulin. So think of insulin as a key that allows glucose to go inside your cells and be utilized as a source of energy. Next slide, please. So prevention of diabetes, it's as basic as eating healthier, becoming more physically active, and losing a few extra pounds. This is all you need to know. What do you want to do for diabetes, prevention of diabetes? Basically, eat better, lose some extra pounds if you have extra weight on, and try to become more physically active. And if you can do just this simple thing, you may, either, decrease your risk of getting diabetes or never get diabetes at all. Making a few simple changes in your lifestyle now can help you avoid serious health complications of diabetes down the road. And also remember, even if you are diabetic, if you're very well-controlled diabetic, you're not going to get in trouble. You're not going to have blindness. You're not going to end up with kidney failure. You will probably never have a heart attack. But if you are uncontrolled diabetic, then all the hell breaks loose and you will have all the complications of diabetes. Next slide, please. So prevention tips, we are going to go over. I think you will think that I'm talking about same thing over and over again, but I cannot emphasize the importance of these lifestyle changes enough. You really have to understand these are very, very important things. Get more physical activity. When it comes to physical activity, 30 minutes most days in a week is required. And this much amount of physical activity actually is required to be considered active. This doesn't necessarily make you lose weight if you're just walking 30 minutes 5 or more times a week, but at least it will help with your circulation and your lung function. Research shows that aerobic exercise and resistance or strength training exercises can help control the diabetes, but greater benefit comes from a program that includes both kinds of exercise and a healthy diet. This will also help you to lose weight, lower your blood sugar, and also boost your sensitivity to insulin, which can help your blood sugar stay within a normal range. Next slide, please. Also, get plenty of fiber. This is important because fiber absorbs some sugar. Foods that are high in fiber include your fruits, your veggies, your beans, your whole grains, nuts, and seeds. It may also help you reduce the risk of diabetes by improving your blood sugar control, because fibers do help us absorb some sugar, and also cholesterol. It lowers your risk of heart disease, and it promotes weight loss by helping you feel full sooner. People actually who are on high fiber diets tend to do better with their sugar control compared to somebody who's not eating a lot of fiber. Next slide, please. So when it comes to choosing grains, remember all grains are not bad. You can eat grains. So whole grains reduce your risk of diabetes and actually help you manage your blood sugar levels. Try to make at least half of your grains whole. Many foods are made from whole grains and they come ready to eat. You can pick up some brown breads or whole grain breads, and you can pick up some pastas which are made with whole wheat. So try to do some swapping when you're doing grocery shopping next time. Try to do a little bit more research, or spend some more time in a grocery store trying to read through the labels. If out of the first 3 ingredients you see whole grain, that means it's a better product than something that does not say that. Very kind of a common and simple example is, if you like to eat bread, it's okay. Even diabetics can eat some breads. but you need to go for whole grain bread compared to, let's say a white bread or processed bread, because that white bread has been processed and all the grain and the fiber has been stripped to make it look better and taste better. Next slide, please. Lose some extra weight. If you're overweight, your diabetes prevention may hinge just on losing some weight. Every pound you lose makes you actually healthier. And there was this large study that was done, and this is really the cornerstone of diabetes treatment in medical community. So there were 3 arms of the study. One arm was put on metformin, and these were like people who were like pre-diabetics. The other arm was put on, and these people who were put on the medicine, as I told you, metformin is the #1 or gold standard medicine for diabetes. This arm of people was told that you have to eat right, you have to exercise, just some directions were given, and they were put on medication. Second arm was really the arm that was told to do whatever they want to do. They were not put on any medication. You have to eat right, you have to exercise. This is how you improve your chances of not getting diabetes. And there was this third arm. In this arm, they had like registered dietitians or diabetes educator and physical trainers who sat down one-on-one with these patients and really made them understand the importance of eating healthy and exercising. And all these people were monitored every 2 weeks. So the study was actually designed to show that metformin does work very well for diabetes treatment. But to researchers' dismay, they had to stop the study before they could finish the study, because after, I think, several months of the study, or I think more than a year of the study, they found that the arm that was the third arm that was told to do strict exercise and were monitored more closely with diet and exercise, their numbers improved much better than the arm that was given medication and was asked to eat right and exercise. So this is what changed how we look at the prevention and treatment of diabetes in our patients now. We know that medications are important if somebody is diabetic, but just taking the medicine alone does not help you, especially if you're a pre-diabetic and do not want to end up on medication. The only thing you need to do is very strict diet and exercise. And nowadays, if we talk about treatment of diabetes, first thing is diet, then exercise, and then medications. We do not jump on the patient with medications, because it is not going to work very well. Because you have to understand, medications have limitations. They will only work so much and to a certain extent. If you keep on putting more sugar in your body by eating wrong, this medicine has to now fight the extra sugar that you're putting in your body, and then it also has to work on the extra sugar that you are making in your body. So what happens in diabetes, it's important to understand that not only you lose your ability to process sugars, something goes astray in your body, that you start producing more sugar than you need. We all produce some natural sugars inside the body, inside our liver, because it's required for us to function. But these diabetics, for some strange reason, start overproducing sugars as they lose their ability to process sugar. So these people now have double whammy. They can't process sugar and they're producing more sugar. So that's how their levels are up. And then, of course, if you can at least do your part and not put extra sugar in your body, then maybe medicines can work better. And if you lose weight, yes, it improves the insulin sensitivity. The medicines would work much better if you're truly a diabetic. Next slide, please. Another thing, if you smoke, you have to quit smoking. There's nothing else I need to tell you about this, because every cigarette that you smoke makes you sicker. Nicotine in the cigarette smoke has been labeled as a carcinogen now. So, every time you light up a cigarette, put it in your mouth, tell yourself you're increasing your risk of cancer. And of course, you can add type 2 diabetes to the long list of health problems that come due to smoking. Smokers are 50% more likely to develop diabetes, even if they don't have diabetes. Next slide, please. So now we are going to talk about how to reverse diabetes. This is interesting. All these years, we have always told you, if you're a diabetic one time, you'll always be diabetic. Not anymore. We truly believe that people who do the right thing can actually beat their diabetes, or at least control it so well that you really may not need a whole lot of medications or may never end up on insulin. So by making lifestyle changes such as adding exercise and improving your diet, many type 2 diabetics can actually drop their glucose or sugar levels back to the normal range. Almost, we can say you have reversed your condition or you're no longer a diabetic. And I have seen it in my practice. It is really interesting and amazing. You know, these patients feel so well, but these are really highly motivated people. They take it upon themselves that they have to do everything right so that, you know, they are now going to beat this diabetes. Next slide, please. Another thing, without exercise, a healthy diet, or controlling your weight, diabetes tends to come back. So don't think that once you have done well for a few months, now you can go back in your old routine, diabetes will come back. You know, because these people have an underlying problem. They really have to be very, very close, you know, on top of their condition, and they have to monitor their sugars very closely. Next slide, please. So management of diabetes, you have to lose weight. I've told you, I think, many times, but I'm telling you over and over again because this is the cornerstone of prevention and management of diabetes. If you've been given any medications by your doctors, there's a reason that you've been given those medications. Please take those medications. Talk to your doctors if you have any concerns about those medications. If you have any side effects, have a very open communication with your doctors. You need to know why you're taking that medication and what that medication is due to your system. Check your blood sugar regularly. All diabetics usually get a glucometer and some, you know, supplies from doctors so that they can monitor their blood sugar at home, and keep your doctor's appointments every 3 months. This is important because remember I told you that every 3 months we check your A1C test, and this gives us an indication of how good or bad your control has been, or average blood sugar control has been in the past 3 months. Next slide, please. So I'm going to touch a little bit about metabolic syndrome. You may have heard this term somewhere. Metabolic syndrome is basically a cluster of most dangerous heart attack risk factors. So there are 4 things that we have looked at, and this kind of compiles metabolic syndrome. These people have impaired fasting sugars or diabetes. They have high fasting blood glucose. They have abdominal obesity, meaning men have abdominal girth or their waist circumference more than 40 inches, and women have it more than 35 inches. Then these people have high cholesterol. They have high triglycerides basically, and low good cholesterol or low HDL. And these people have high blood pressure more than 130/80. So if you have high cholesterol, high bad cholesterol or triglycerides, and low good cholesterol, you have high blood pressure, you have abdominal obesity, and you have impaired fasting sugar, that means you're either pre-diabetic or diabetic. Now, this is a cluster of things that increase your future risk of heart attack, and this is called metabolic syndrome. Next slide, please. The causes of metabolic syndrome seem to be very tightly interconnected with the causes of type 2 diabetes. So your risk of heart disease, diabetes, and stroke increases with the number of metabolic risk factors that you may have. And, you know, risk of metabolic syndrome is closely linked to being overweight and lacking physical activity. Remember, one component of metabolic syndrome is increased abdominal girth. Just to let you know, guys, you know, the studies have shown that people who have apple-shaped bodies, meaning more fat around their abdominal area, have more risk of heart attack compared to somebody who has a pear-shaped body where they have more fat around their buttocks. Why is that? We don't know. But abdominal obesity has been now considered a heart risk factor for a long period of time because of these studies that have shown us. Next slide. So at Kelsey, we do have a lot of diabetes management programs. You can see diabetes educators if you are already a diabetic, or you can attend a diabetes education class. These are just open to public general classes, or you can see registered dietitian if you want to talk about, you know, your diet in general. And these people can talk to anybody, whether you are diabetic or not. You know, you can talk to them just because you want to talk about how should I eat right, or I have high cholesterol. And I think your best source is still your primary care doctors, or you know, doctors that you have a connection with and you see them regularly. Next slide, please. So good information resources, try to go to American Diabetes Association website. They have a lot of, information for everyone. They actually talk about some recipes that people can, during holidays especially, you can get some recipes from American Diabetes Association website. And of course, Kelsey Siebold website, we have a lot of educational materials on diabetes. And I think this pretty much brings me to the end of my discussion. And I'm open for any questions that you guys may have for me. Thank you everyone who attended this seminar today, and please send me your questions.
Okay, thank you so much for that very informative presentation. We're going to open up the floor, as she said, to questions. You can place them in the chat, or if you feel comfortable, you can unmute yourself to ask a question that you have. I know it's a smaller group today, and so that shouldn't be an issue. But I do have a question for us to get started.
Sure.
So I used to work as a scribe a couple of years ago, and I learned a lot just being in the room with the doctors. And a lot of people who, especially were newly diagnosed diabetics, were very hesitant to be started on medication. And so, like you mentioned, nutrition was an option, physical activity, but breaking those bad habits can be kind of hard. For those who may need to go on medication for management and are kind of hesitant, what do you tell them about that?
Okay, so it's an excellent question. We always have to make our patient understand why are we asking them to take medication. And it's all solely based on their HbA1c numbers. If I see a patient, so remember I told you if your A1C is more than 6.5, then you are a diabetic. Now, if somebody comes to me who's a newly diagnosed diabetic and the number is 6.7 or 6.8%, and if this is a highly motivated individual, I am going to tell them, okay, you are a newly diagnosed diabetic. You just became a diabetic probably. Let's try diet and exercise if they are hesitant with medication. Medications do have their own place. As I told you, metformin does decrease the risk of colon cancer also, and they have some anti-inflammatory properties also. So we do believe that some of these medications may decrease your future risk of heart disease. But, everybody is not going to listen to that. Now, if there's another patient who has A1C of 9% or 10%, that means their sugars have been around in between 200, 300 range. This patient, really, it will take forever to get their numbers down with diet and exercise. And remember, everything you do, whether you do lifestyle management or medications, they have limitations. And one does not work without another one. It is important to have lifestyle changes, but it all depends on your A1C number. If starting off your fasting sugar is in 300s and your A1C today is over 10%, I am not going to wait for you to eat right and exercise and come back in 2 months, because I know the damage has already been done in your body. Diabetes it doesn't change from one day to another. It is a big, long process. So people who come to us and are considered bad diabetics or have very bad numbers, they probably had this high sugar level for a very long period of time. So it usually takes 10 to 15 years for, organ damage and for you to manifest some complications. So if I see somebody who already has a complication due to diabetes, meaning their kidney function is already bad, I'm very worried about this person. I have to start this patient on medication to stop the kidney damage or to reverse some of the kidney damage. And, these are the people who are going to need medication. So we sit down with them, and this is a long discussion with this patient. We try to make them understand, why are we asking you to do this? And what are the harms if you say no to the medication? And it is a long discussion, but most times, I would say more than 95% of time, patients understand. Because if physician takes time to explain to patients, why are we doing what we are doing? I don't see any reason why patient would not, want to, improve the health of, their own health. So I think it's a discussion. It requires time. It requires some passion on part of physician also. And, patients usually will comply. They just need more understanding of why we are doing. And I've seen that patients who do well with their diabetes management are the ones who understand their condition. And then they are more willing to be a participant in their healthcare.
Thank you for that answer. Going off of that, you talked about the complications of uncontrolled diabetes, and clearly, it affects multiple systems and multiple areas of the body. So are there specific specialists that diabetics need to be following up with on a regular basis?
Okay, so yeah, then again, it depends on numbers. A lot of primary care doctors will pretty much manage your numbers, but these patients with diabetes have to see an optometrist every year. That is a requirement because they need to have a dilated retinal exam to look behind their eyes and make sure there are no changes in the eyes. If their diabetes is really bad and affecting their kidneys, sometimes we end up sending them to nephrologist because you don't want your patients to end up on dialysis. Sometimes we need help from our endocrinologist. If I have tried you on 3 different medications, either they are not working well or you continue to have complications, and I am at a point where I think, you know what, I need a specialty opinion. Then at that time, we will send our patients to see endocrinologist. Other than that, we want them to have their annual dental exams and see podiatry for their feet, because these people can lose sensations. Some doctors do their own foot exams. I do my own foot exams mostly. Unless patient develops an ulcer which is not healing, then we send them to podiatrist. But if you're doing their annual foot exams and their sensations are intact, then primary care can pretty much take care of that. But sometimes these patients do end up seeing, as I said, optometry, endocrinology, nephrology for kidneys, and podiatry for their feet. And cardiologist is involved if they start having problems with the heart.
Okay, thank you. So this next question came from one of our participants, and she said that you mentioned that kidney failure can be caused or is usually caused by high blood pressure or a diabetes. Why is that? Why is it that those diseases are tied or related?
So kidney failure is due to diabetes or high blood pressure, mostly in this country, because these 2 diseases affect your kidney the most. These diseases do affect your heart also, but they affect kidney the most. In fact, several years ago, it was a recommendation that anybody who's a diabetic must be on a medication which was called an ACE inhibitor, which is called renal protective. To protect their kidneys, we had to put you on a medication just because you were a diabetic. That recommendation is no longer in effect, because we also found out that medication has some side effects, so we don't give these to our patients anymore. But any diabetic, anybody, regardless of your cholesterol number, now needs to be on a cholesterol medication, a statin medication. This is a new recommendation by American College of Cardiologists, because we keep on doing studies and research on these conditions, and we find out that due to some reason, diabetics start having more inflammation in the arteries that are supplying their heart. So that's how they have more increased risk of, heart disease. So these statin medications or cholesterol lowering medications also, to some extent, decrease the inflammation in the arteries supplying the heart. So now every diabetic, regardless of their cholesterol numbers, needs to be on a cholesterol lowering medication or a statin medication. And really, I try to explain to my patients that we are not giving it to you to improve your cholesterol number if your number is already good. This is being given to you because it has a bigger purpose of decreasing inflammation so that you don't end up with heart disease. Same thing with kidney. Due to some strange reason, these people start having more effect on these 2 organs, their heart and their kidneys, and we have to protect those organs because these 2 are our vital organs. And these diabetics, every time they have the blood test, they check their kidney function. Every single time they have a blood test, they are going to check their kidney function at least once a year or more, depending on which way they are headed.
Okay, thank you. So going off of, or moving more, I guess, towards management, how often should diabetics be checking their blood sugar? Do they check before eating, after eating? I know it probably is different depending on how well controlled your diabetes.
So that's a very good question. Actually, guidelines change so much. So American Diabetic Association now says that home monitoring of sugar is not even important if you're not on insulin. So only people who are on insulin should check their sugars at home. This is a new recommendation from American Diabetes Association. The reason being they think that the more effective way of measuring your sugar is HbA1c, which is done every 3 months in a doctor's office. And that's a new recommendation. We still tell our patients if they're newly diabetic to check their sugars at home because it kind of makes them feel good if the numbers are better. So when you're checking your sugars, the most important sugar is your fasting sugar. So that should be done after 8 hours or more of fasting. So early in the morning when you wake up, you can check your sugars. And that the numbers I gave you, if it is less than 100, it's normal. If it is between over 100 to 125, it's pre-diabetes. So it's a good kind of tool for patients to kind of monitor their own sugars at home. After eating, meaning 2 hours after eating postprandial, and we say 2 hours because this is how much time you require to absorb all your sugars that you are related to eating that particular meal. So after eating, anytime your blood sugar level is more than 180, you have diabetes or you have uncontrolled diabetes. So your number ideally should be around 140 to 180. Anything beyond that, postprandial or after 2 hours of eating, then you have an issue. And if you are taking insulin, then you, of course, have to check your sugars a lot more often, because if you're taking insulin that you adjust based on how much carbs you will have in those diets, then you have to check sugar with every single meal. So that's a different management style, because some people go on insulins, which they do carb counting, and they are taught carb counting. How do you count your carbs in everything you eat in your particular diet? So based on the carbs that they will be taking in each particular meal, they have to adjust their insulin accordingly. So they inject themselves however many units based on whether they're going to have a big meal or a small meal, or if these people skip meals, then they don't take any insulin. So that category of people will have to check their sugar much more often. But if you are just monitoring your sugar and you are only on oral medications, I tell my patients 2-3 times a week is fine. You don't have to do it every single day. But if somebody is really motivated, wants to make charts and do everything right, these people will certainly end up doing more often. But as I told you, American Diabetic Association does not really force physicians to tell their patients to check their sugars at home every day.
I'm sure a lot of patients are very happy with the new recommendations.
Yeah, because it's needle sticking in your finger, and poking your fingers is not fun.
Yes, yes. So the next question is, so you talked about type 1 diabetes a little bit. You mostly spent your time with type 2 diabetes. As far as management for gestational diabetes goes, is that much different than that of type 2?
A little bit different than type 2, because mostly in pregnant women, really a lot of emphasis is put on eating right. And these women actually end up on insulin, not on medications. It's only because medications can have detrimental effects to the baby. So most of the gestational diabetes patients are managed by usually endocrinologists in conjunction with the OB-GYNs, and primary care doctors don't manage a lot of gestational diabetes, only because these people really need to be very tightly monitored. They see diabetes educator and end up on insulin if their sugars are that bad. And their control is very tight. I mean, these people are pretty much checking their sugars 4 or 5 times a day.
Okay, wow. So we know the importance of eating a healthy diet, but when you eat, can that play into your management as well? So when you decide to schedule your meals throughout the day?
So for somebody who's not insulin dependent, it really doesn't matter. You can eat however you want to eat. But we also tell our diabetics that eat smaller meals multiple times a day rather than shocking your body with big meals at one time. Once in a while, if this is a festive occasion and you'll be eating a big meal, especially if you're taking insulin, then you have to be very careful, because you have to adjust your insulin level according to what you would be eating. But any other person who's, let's say, even if they are diabetics and they're taking oral medications, we want them not to stay hungry for too long. Because these people, their sugar level goes like peaks and troughs. For most everybody else who's not a diabetic, After we eat, our sugar level goes up and then it gradually comes down as insulin is released. These people have lost that kind of tight control in the body. So their sugars go up and then they come down quickly, and then they go up and then they come down quickly. So these people have what they call carb crashes. So they feel very, very hungry in between if they have longer period of time in between two meals. So diabetics are always taught to eat some light snack like nuts or a fruit in between their meals. We do not want these people to do intermittent fasting or go on long fast, only because their body is not going to be able to adjust the internal sugar level very well.
Thank you. And then I have one last question here. Do you have any recommendations for diabetics who have a sweet tooth?
Okay. So yes, a lot of diabetics really want to eat sugary stuff. So we only tell them, okay, you can eat natural sugars because those are processed much different than processed sugar. So natural sugar is something that is found in fruits, that's found in vegetables. We also tell our diabetics that eat more vegetables than fruits. But if you really want a dessert, go for fruits. If it's a festive occasion, you really want to have that piece of strawberry cheesecake or something, okay, go for it, but not the whole big slice. You can eat a little bit of that. Tell yourself, any processed sugar or any added sugar that you put in your body has to work very hard to break it down. And it does not have a lot of ability to break down this added sugar. So eat more complex carbs. Complex carbs are, natural sugars or whole grains. So I tell my patients, eat banana, eat like an orange, eat something which is more naturally sweet. And also we tell our patients, don't go in for, those sugar-free sweeteners. Those are really considered as bad as plain sugar. And really, the new research has shown that all the kinds of sugars are pretty much same, with one maybe a slightly better than the other. But when it's diabetes, you have to understand any sugar is bad sugar for you. So if you really feel compelled to eat something, maybe sugar-free ice cream here and there. But these people, this is a lifestyle change. These people have to really understand that they cannot have sugars. I think somebody's asking a question about stevia. All of these are bad, okay? One may be a little bit better than the other, but our goal is to make these people understand that you can't have sugars. You just have to let go sugars. You have to change your lifestyle where you just do not need these sugars. So, people always ask me, can I have Diet Coke? I can have Diet Coke. And we tell them, no. Regular Coke and Diet Coke, we put all soda in one category. Start getting some unsweet iced tea or water and start putting orange slices or strawberries or some kind of fruit in there and start making it sweet, or change the taste with the natural sources, and try not to add any sugars. It takes a lot of work. It is hard. But as I told you, if you have a good discussion with patients and you coach them well and you spend your time with them, I have seen that most of times patients really understand. If they want to improve their health, as I told you, it's a partnership. They have to do their part and we have to do our part. It's kind of relationship that doesn't work if one party is not giving their best. So it's hard, but it's doable.
Absolutely. Well, thank you so much. I know that I, learned some stuff from this presentation, and I know that the people on the call learned things as well. I will definitely pass along that recommendation. I know a lot of people, or not a lot of people, but there are some people who say, well, I just don't like the taste of water. So using natural sweeteners like fruit, to kind of
and
add
putting mint or cucumbers or anything that like herbs that change the taste of water for you, I think, and putting lemon slices, orange slices, that helps.
Absolutely. Well, thank you so much for this wonderful presentation. I have a few closing slides here myself. So if you do have any questions or comments after the presentation, I know sometimes when I leave a presentation, I have a question a couple hours later, a couple days later. You can feel free to email those questions to healtheducator@thewomensfund.org, or you can utilize some of those resources that Kelsey Siebold does offer as well. We do have a survey for this presentation. I will send out the link in the after presentation email. If you take the survey, your name will be entered into a raffle to win a $25 gift certificate. And then finally, these are our social media sites. So I encourage that you visit our website, check that out, follow us on social media to see what we're up to and our upcoming events. For the rest of the week, we have a goal setting and decision making presentation later this evening. And then Friday, we have a presentation on Alzheimer's and also on holiday stress. So I again want to thank our sponsor, Kelsey Siebold, who sponsors our wellness series and also provided our speaker today. Dr. Sehgal, thank you again so much for your time.
Thank you so much.
Bye.